Hello everyone, I'm pleased to present my research project at EACR Imaging Cancer Virtual Conferences. My name is Carla Faria. I'm a PhD student in Team 9 of CRCT in Toulouse, France, led by Camille Laurent. I will present our work on 3D model characterization by 2D and 3D imaging in B non-Hodgkin lymphoma, which opens in vitro perspective for drug screening in follicular lymphoma. First, a few words on this cancer. Follicular lymphoma is an indolent B-cell lymphoproliferative disorder of transformed follicular B cells, which account for 20 to 30% of all NHL cases. There is still no cure for this disease, but thanks to the introduction of rituximab, an anti-CD20 monoclonal antibody associated with chemotherapeutic agents, the patient's overall survival increased dramatically. Unfortunately, some of them are refractory and relapses are unavoidable. This encouraged the research community working on this pathology to identify new targets to propose more efficient therapies. Nevertheless, there is few in vitro models suitable for drug screening and they are not characterized in depth. That's why we established a 3D model dedicated for in vitro drug screening and developed all the technologies allowing an in-depth characterization. Here's an overview of our workflow. We culture B-NHL cell line called RL first in suspension, and then, thanks to specific 96 plates called ULA for ultra-low attachment, we perform the seeding of 2,500 cells per well, and we do a centrifugation in order to shape the 3D model. Those models are called ULA MOLC for multicellular aggregate of lymphoma cells. After 3 days of culture, we added the drugs to be tested, and after 3 days of treatment, we evaluated morphological features and cell growth behavior by 2D and 3D imaging, in order to assess the robustness of the model and treatment efficacy. First of all, in order to determine the best cell seeding density to obtain a regular and spherical 3D model, we used an operetta system, an automated high-content imaging microscope. We measured different parameters on the 3D model, such as projected area and roundness. In parallel, on dissociated model, we determined the cell viability and cell counting. As showed here, the 2,500 cell seeding is the most suitable cell density to obtain a robust and reproducible model. Then we determine the effect of different drugs such as ABT-199, a BCL2 inhibitor, rapamycin, an mTOR inhibitor, doxorubicin, an anthracycline, lenalidomide, an immunomodulatory agent, ibrutinib, a BTK inhibitor, bendamustine, an alkylant agent, and to finish, we combine those drugs or not with two monoclonal antibodies, anti-CD20, rituximab and GH101, also called obinutuzumab. Thanks to morphological analysis on the operetta system, we were able to extract parameters like the area and the area of PI spots normalized by the area of each models. In parallel, we dissociated the model in order to perform flow cytometry with 780 staining to evaluate cell death. On one hand, those data we observed that the model area decreased with almost all the drugs. On the other hand, we observed no increase in the PI staining after treatment with rapamycin, which is expected because of its cytotoxic known effects. But we were expecting more PI staining for the cytotoxic drug like doxorubicin or bendamustine. When we went to flow cytometry, we were able to assess the cytotoxicity for those drugs as expected. These discrepancies between 2D imaging and flow cytometry led us to characterize in depth the ULA MOLC by 3D imaging. To do so, we used a light sheet microscope. In contrast to the observations obtained by 2D imaging, the ULA MOLC did not appear as a perfect sphere and the morphological parameters are strongly impacted during the days of culture. Indeed, in contrast to the thickness, which is quite stable, the diameter increased during the days of culture and the model became more flatter and less spherical. We also compared the projected volume estimated from the 2D image and the real volume evaluated with 3D images, and we observed an overestimation of the projected volume in 2D after day 4 of culture. To finish, we performed the same analysis on treated ULA MOLC. Thanks to 3D imaging, we were able to observe drug effect in structuration, shape, volume, and morphology that we didn't observe with 2D imaging. For example, with the GA101, we observed a compaction of the model due to the monoclonal antibody. As we did with the untreated ULA milk, we observed that the projected volume was overestimated in comparison to the real volume, which can lead to misleading conclusions in terms of treatment effect. To conclude, here we developed a new technique to generate B-NHL 3D cell culture that is easy to handle, inexpensive, robust, and reliable. This method allows by a simple workflow an increase in the throughput for drug testing, offering new perspectives for preclinical studies. Moreover, our study reveals potent discrepancies between the results obtained from 2D and 3D imaging and warns the scientific community as to possible misinterpretations following 2D imaging. Also, this study opens encouraging perspectives in terms of model development of patient-derived lymphoma spheroid, or PDLS, integrating tumor microenvironment. This may allow in the future a better B-NHL biological characterization and preclinical studies in a more relevant and complexified system, better recapitulating disease heterogeneity and microenvironment contribution. These models will take a central place in the global strategy of patient characterization necessary to propose a personalized medicine. I thank you for your attention and I invite you to scan this QR code to have access to the full publication of this work. Please do not hesitate to contact me if you have any questions.